Aloha, everyone. I trust you are making the most of your day. Welcome to Dr. P's Facets of Life series. This is pod number 39. Today's topic, life after a cancer diagnosis. Although the news contained in a cancer diagnosis is generally considered to be bad news, the actual news about cancer is better than ever. Fewer people are dying from the disease, and people are living longer and better with cancer than ever before. People are also learning to live well with, through, and beyond it. So, what is cancer really? Cancer occurs when all of the following things happen. An abnormal cell appears in the body. Then the cell continues to divide and subdivide after it should have stopped doing so. These new cells eventually form a clump called a tumor. If unchecked, this clump will grow large enough to interfere with the delivery of nutrients and oxygen to nearby organs. The abnormal or cancer cells are of the type that can survive in parts of the body other than where they originated. Cancer is the generic name for more than 100 diseases that share similar characteristics of malignant cells. For cancer to be treated successfully, not only must the original tumor be controlled, but the spread of the disease, what is called metastasis, must also be stopped. Let me just say a little about the immune system here. The immune system is our first line of defense. It is an intricate system designed to protect the body from disease. For cancer to take hold, the cancer cell appears when the immune system is not strong enough to rid the body of that cell. One way to think about cancer is that the cancer cell is not strong itself, but that the body's immune system is not strong enough to carry out its assigned job, which is removing cancer cells from the body. This view of cancer is generally known as the immune surveillance theory. Okay, so now what? Well, shock, disbelief, fear, confusion, anger, these are all normal reactions. Once we move a little beyond our initial cognitions and emotions, we begin the struggle to come to terms with the impact this diagnosis will have on our lives. So what do we do next? I think we begin by taking a full, deep breath, and we continue doing so on a frequent basis. It is really important for you to realize and remind yourself that you are the same person you were before your diagnosis. It's also important to realize that cancer will change your life, and the sooner you can adjust to that fact that your life has changed, the sooner you can participate more fully in managing your illness. More than ever before, advances in treatments have resulted in improved outcomes, leading to larger numbers of disease-free, long-term survivors, as well as prolonged survivals for metastatic diseases. I want to talk now about self-advocacy. People who participate in their fight for recovery, along with their healthcare team, will improve the quality of their lives and may enhance the possibility of recovery. It is confident that you feel comfortable about your treatment plan for your cancer. Sometimes it may be useful to get a second or third opinion in order to be certain that you are being offered the best medical treatment possible. Actually, some insurance programs even require second opinions, and many will cover such costs if the patient requests one. Be comfortable and confident in the plan that your team is recommending. Once this is the case, then remember that communication is the basis for clear understanding and positive commitment. Be as actively involved with your healthcare team as possible. Treatment for all types of cancer is constantly evolving, but decisions that need to be made regarding your treatments are ultimately yours to make in partnership with your healthcare team. While many treatment options have similar statistics about the potential outcome, the side effects can vary widely from one treatment to another. So talk to your doctor about treatment outcomes as well as treatment side effects. Do this to determine which option is most acceptable for your lifestyle and treatment goals. You may even want to be made aware of clinical trials that might be available and appropriate for your situation. Every person's experience with cancer is quite unique. You may not experience every possible side effect, but being aware of what might happen can help reassure you that certain side effects are normal and, as a result, better prepare you for dealing with them. More importantly, being better informed may enable you and your doctor to prevent or proactively manage side effects so they won't disrupt your treatment, decrease your quality of life, or even impact your possibility of recovery. Ask as many questions as it takes to allow you to feel well-informed and comfortable. Make sure your healthcare team answers all of your questions. It would be wise to have someone accompany you to your appointments to take notes and be a second pair of ears. Keep a log or a journal for recording notes for all appointments, and also to keep notes about any physical or emotional changes that you might experience. These will all be helpful to your team. What about living with cancer? Well, research has shown that a segment of cancer patients experience elevated levels of emotional distress. This distress extends along a continuum ranging from common feelings of vulnerability, sadness, and fears to problems that can become more disabling, such as depression, anxiety, panic, social isolation, and even existential and spiritual questioning. Emotional distress can make coping more difficult. It can even impact the immune system adversely. So the first and most important step in dealing with this is to acknowledge when it is a problem and ask for help and support. It takes time to accept your diagnosis and to understand what it will mean for both you and your family. And speaking of family, understand that when you were diagnosed with cancer, they were also diagnosed with the disease in an emotional way. If you're blessed with close family and friends who may become caregivers, communicate and share this journey with them and allow them to give their gift of you of giving, their gift to you of giving. Connecting with a supportive network of family and friends as early as possible in the treatment process often offers a better prognosis. Now, depending on your situation, you might want to avail yourself of a support group. They also can be a wonderful resource of information, strength, and trust for you. My final thoughts are to encourage you to take the best care of yourself possible. This means eating the best diet possible to build and keep your strength. It means exercising in whatever way your physician and your body allows. And it means getting as much quality sleep and rest as you can. Your healthcare team can provide you with the resources to help with all of these things. Well, I know this is a tough topic, but I hope what I have offered you helps in some small way. I wish you the best outcome possible on your journey. Remember that gratitude is the best attitude. This is Dr. P saying aloha.